Oo, as always naman, of course, I will always be very supportive of this product, this company, and of course, my very good friend, si Ma'am Arlene Del Rosario. So when she asked me to actually know more about this product, so nakita ko that the product really is, second nature to me since she mentioned that I am a botanist pero medyo of course medyo tall yung medyo mataas yung sinabi ni Ma'am that lahat ay alam ko no hindi naman in the sense that of course there are those that are really close to my heart since that it has been part of my research during my botany pharmacy days no so medyo yun lang po yung medyo nakakitaan ko ng potential that was way long ago. Wag na nating alamin kung ano panahon po. Pero of course, when I saw this, okay, that this is actually lumped into one bottle, medyo talagang sabi ko, wow, parang may katuparan ng mga ng mga pangarap or what, no? So medyo sabi ko, oh, these are all the very potent ones. Then of course, I have grown further onto this because nakita ko siya. It's not just because it's a medicinal plant that is available by scientific researches and trials, no? But it was actually it has already been used in the Bible way before us, way before Christ, no? So parang it has already been proven, no? So parang kahit sino who would be going against it or who would be attesting against it when it has been known for its potential healing effect, no? Of course we are not into the claims of that this is therapeutic in the sense as it has been categorized as a supplement po. So and then of course yes, I am, but it's my pleasure to be educating, to be propagating things, especially if it will help the majority of people, not just the Filipinos, but people around the globe. Since we are all very fortunate that this product is coming from the Philippines and it's globally being outsourced. No? So medyo nakakatuwa that later on, you will be benefiting from all these things that we have been collaboratively doing, and then we're all like helping each one to grow and progress. At the same time, we're health what's this advocates, no? I should call every one of us as health advocates and at the same time health warriors. So we're not just going to allow a certain virus to parang dampen all our enthusiasms, our eagerness, our hopes and ambitions or whatever, no? Kahit alam na natin marami nang nangamatay, but then of course it has to stop. And by just doing this, okay, we are actually helping, okay, to stop or actually promoting the non-progression of all these viruses. Now, okay, let me just correct. It's not a new thing, meaning it's not a new virus. It's actually just a mutation or a variant of the COVID-19 virus. Just like the beta, the delta, the omicron, these are just variants. Parang another flavor ni COVID-19, no? So ngayon, bakit ba nagkakaroon ng mga variants? We'll have the incorporations of or an update of the omicron in a while as we progress, no? And then of course, let me just tell you that this is not a replacement for anything. Meaning, of course, for your limbawa, pag uminom ka nito, hindi ka na magkakasakit. Now, we're not just saying that, but we are going to prevent you from getting sick. Since, of course, when you are actually doing a lot of things like, okay, Christmas season, talagang bumagsak lahat ng mga ating mga immune system. Why? Puyat. Kain ng kain. And of course, wala tayong ginawa kundi those things that laro, of course, mga lahat ng games, ML, hindi na ako masyado dyan, of course, and a lot of things that would actually compromise our immune system. So we'll talk about that. For first timers, medyo okay, I will have to go on to the details for you to have a better grasp of what we are having or what we are actually promoting. So, okay, so let me just share you my screen. Okay, so that we will start our lecture. All right. Although I don't know where I actually sandali Uh, uh, ito, PowerPoint. So, Arlene,
Yes, yes, Doc.
can you see that particular? Oh, actually,
Screening
sabi ni
share.
Ma'am A, sabi I have to incorporate the Omicron. Sabi ko, sige, parang okay, I actually had to do diligently that, with due diligence, I had to actually incorporate some. Oo, ayan. So medyo,
Thank you, Doc.
alam mo naman, oo, syempre, we need to inform everyone. But don't be threatened, no? Of course, with Omicron, well, it may be a variant, pero of course, comparing it with the Delta variant, it's far more parang milder than as compared to the Delta. Okay, so we'll talk about that later. You want me to enlarge it? Can you see my slides already, ma'am?
Yes po. Yes, Doc.
Okay, you want me to have it bigger?
Sige po, yan, kiklik mo po yan.
Yes, oh yeah.
Yan.
Oo nga, sana gumaling din na si Ma'am Kay. I'm sure she will because of well, of course, it's not because that hindi siya umiinom or kulang yung pag-inom ni Ma'am Kay. Of course, there are some other potential virus or bacteria, and of course, pwede din bumaba ang immune system as I have said dahil sa lahat ng mga activities natin for the past holiday season. So medyo talagang maaari ka pa rin bumaba ang immune system,
Yung
no?
puyat-puyat,
So
Doc. Puyat.
yung
Yan.
puyat, number one yan. Stress
Yes.
also. So yan yung mga papababa ng ating immune system. So pag medyo bulol-bulol po, pasensyahan nyo na po. Medyo trying my very best para ano siya, I don't know, to say it, no? Parang yes. Okay. Now let's go into our topic. So it's a preventive therapy with essential oil blends having antiviral, anti-inflammatory, and immunomodulatory properties. My God, no, nandami mga terminologies. I'm sure medyo ang hirap mabatid. Tama ba, ma'am?
Absorb.
Oo, ma-absorb. Like, okay. So pag sinabi po nating preventive, so himayin natin po itong ating topic. No? So preventive meaning bago pa magkasakit, kinakailangan may ginagawa ka na therapy para hindi ka magkasakit. Of course, prevention yon. So sabi nga nila, prevention is better than cure. So how do we prevent? By using these essential oil. So essential oil, ito po yung mga ginagamit natin pang-apply, pang ano. Yes, it may be yung mga ina-apply. Pero of course, there's several grades of oil that actually are being used, but we are using this medicinal oil blends, no? So medyo we will talk about that. So medyo medical grade siya. So and then of course it has antiviral. Okay, it's not just actually for viruses, but later on we'll try to compare it with the
na-unmute ko?
Yan. Doc, na-mute. Doc, na-mute ka. Yan.
Okay,
yan.
so I don't know where
Doc,
actually
excuse lang po ulit. Hindi po siya naka-enlarge, Doc. Pakipindot mo po yung yung sa PowerPoint mo.
hindi naka-enlarge.
Naka-enlarge po. 'Di ba yung kaninang i-click mo dun sa right side mo kanina.
Sandali
Yung sa PowerPoint yan.
Yeah, sige. Yan. Naka-ano na, ma'am?
Hindi pa rin po, Doc.
Hala, bakit kaya? Chester, hindi daw na-enlarge. Oh, di ba? I have to call my dito. Hindi daw na naka-enlarge.
Or F5, Doc. F5. If you can see F5. Ayan ito.
F5.
F5.
Yan. Hindi pa rin.
Hindi pa rin, Doc eh. Di ba dito po sa right side, yan. Ay, ikaw
Yan.
yung nandyan. Ikaw yung nandyan. Nawala yung PowerPoint mo.
Yung PowerPoint, yan.
Hindi naka-show ang PowerPoint. Yan.
Yan, okay na. All right, yan. Thank you. Okay.
Okay, thank you,
Ito na.
Doc.
Oh, yan. All right, so going back, I don't know where I actually was not seeing. So preventive therapy, sabi ko nga po, even before, okay, the disease or any of our exposures could set in and having us, okay, some illness or any disease. So we have to do some measures that is to prevent the disease, no po, preventive therapy. So with the use of essential oils that are actually medically grade, no, hindi po yun siya yung panluto or for mga industrial. So iba pong oil to. So it's more on medical that is used for human beings, no? And it has antiviral. So it's more of antiviral that we are talking to because it's proper to be talking about it since most of our mga exposures are viral, no, rather than bacterial. Although concomitantly, no, magkasabay po yan na pwede po sabay pong magkaroon ka. So iba nagkakaroon bacterial infection at the same time viral infection. So kaya kinakailangan po, importante po, alam natin kung ano yung causative or yung etiologic agent or yung agent na nagko-cause ng iyong infection. Tapos meron po siyang anti-inflammatory effect. Meaning, of course, pag may infection, there's always an inflammation. Meron pong pamamaga ng mga cells o ng mga tissues or organs. And then, of course, hindi po mawawala ang inyong fever kung meron kang inflammatory cells or reactions na nangyayari sa katawan. No? Kumbaga, say, for example, tonsillitis. Kaya po may itis doon, ibig sabihin it's an inflammation of your tonsil. So pag may inflamed doon na tissue or yung organ, yung iyong tonsils, okay? So magkakaroon ka ng fever, no? So yun yung ngayon. Mamaya pag-usapan natin yan. And then immunomodulatory properties. Okay. Ano ba yung sinasabing immuno? It's actually your immune system. Okay, it's your defense against, okay, all these causative etiologic agents or mga viruses, bacteria that can actually infect human beings. And you need to combat that by having a very good immune system. And sometimes, parang mga sundalo din, napapagod din po ang ating katawan or yung immune system to defend against all these mga agents, attackers, or foreign bodies that would go to our body. And then, of course, they need to be supplemented. They need to be boosted. So that's why we have this to modulate the immune system. So that's what we're going to. Ito ba yung buod ng ating pag-uusapan ngayon? Okay? Okay, so for those who have questions, I will be answering the questions in a while after we finish the lecture for the continuity. No po? So then you can just have all your questions raised in a while. Okay? And then, as we have been constantly asking in our brains, in our minds, ano ba yan? Bakit virus na lang, not virus every now and then? Because there are so many viruses in the world. So in the universe, actually, more than the stars that we can be counting. I don't know if some one of you can be counting all the stars, but one thing is for sure, it's the stars are smaller in numbers than the viruses that can pose a lot of, deleterious effects sa ating katawan as human beings, okay? So, an estimated 10 nonillion, which is 10 to the 31st power. Nonillion pa lang, million pa lang, medyo mahirap ng bilangin, no? Of course, nonillion, I don't even know how to. So, it can infiltrate any aspect of our natural world, meaning anywhere, everywhere we go, lahat po yan may viruses and bacteria that are actually proliferating. That's the reason why kami sa mga OR, anything that would fall below our waistline, also definitely hindi po namin yan na kukunin, dadamputin, especially at the height of the OR or surgery. No? So kasi, of course, that's laden with all the bacteria or these microbiologic agents, viruses, nandiyan po yan. So hindi po tama yung sinasabi, ay nahulog yung pagkain, wala pang 5 minutes, okay, pwede mo pang kainin. No. So lahat po ng nahulog waste down, okay, and it's actually contaminated. So you don't even know whether there is bacteria or virus or any other parasites that can actually cause some disease in your body. So it's a non-living entity. O bakit ganun? Sabi mo nakakapasok sa atin, but it's non-living. Yes, it can actually be going inside our body to replicate inside our cell. So it needs our cell for it to actually multiply, for it to actually propagate. No? So mamaya aalamin natin kung paano ba yan. Of course, this is the SARS-CoV-2, which is the topic of siguro 2 years, no, almost 2 years that we've been trying to battle it out with, no. So SARS-CoV-2 or severe acute respiratory syndrome coronavirus 2. The coronavirus 2 is the one that is causing havoc and lethal or deleterious effect to our cells and organs and body. No, importante po, ito po ang structure. Ang ganda-ganda niyan titignan. Lalo kung titignan niyo po sa electron microscopy, that mas maganda po yung mga struktura. Okay, this is the spike. Okay? That's why yung paikot niyan, kaya siya tinawag na corona because it looks like a crown. No, paikot sa katawan, okay, attached to the membrane of that particular virus. So, take a look at this. Ito po ang nag-mutate. Yung spike po nitong coronavirus is mutating. That's why we have several variants that are coming out. Ito yung Delta, ito po yung Omicron. Okay, some would call it Omicron. Okay, so depending on how you would say it, but of course, it's just one and the same. No? So, of course, it's important, okay, for the replication, kailangan nitong RNA na ito na maisiwalat niya doon sa isang cell natin. And then later on, doon na siya mag-uumpisa mag-replicate and mag-propagate ng mas marami pang virus na anak. No? So, kayang patayin or kitilin ang buhay ng isang tao in just 4 hours depending on how strong the immune system or how capable your immune system is in combating or actually trying to eradicate itong SARS-CoV-2 or the virus, no? Okay, let me just tell you, we're not just into the coronavirus. Okay, this would also encompass other viruses that we have experienced in the past. Okay, so of course, let me just give you an update of what Omicron is. Okay, so on November 26, 2021, WHO designated the variant B11529. So it's named Omicron. So, and then of course, it has the, well, at that time, they don't have, okay, any of the interpretations onto how virulent this, okay, and how has this mutated per se. And then of course, ang ano lang nito is actually, it's really existing already that time. So, medyo meron na pong Omicron. So, it's not clear of how transmissible this is, no? Okay? Or how, or in comparison to Delta, kung mas mabilis ba siya. But then of course, yeah, they're really looking into this as faster than as compared to Delta. Faster siya in terms of transmission. That time, Delta, of course, we all know that it could be transmitted through sneezing or coughing or talking. No, but then of course nowadays, okay, with Omicron, they're looking into the potentials that it is really airborne now. So meron kasi mga cases that they are actually compliant with the mask, and of course some of those who are actually using the face shield in the hospital, that they're still acquiring. So ibig sabihin po, Kasi po pwede na po na talagang it's in the air, and then of course it could be just zipping through the spaces, no? Yung iba kasi hindi nagmamask ng tama. Yung iba nakamask, nakapasok, nakababa hanggang dito sa ilong kasi nahirapan daw silang huminga. Di syempre, direct ang papasok doon sa ilong. No po? Then of course, there are those na medyo maluwag or hindi snugly fit yung kanilang mga mask. And then it could easily be zipping through. And then of course, there's also the kind of mask that that is really very important for you to be using to prevent it. Yung um, uh, KN95, that's actually the one that we can actually be requiring for you to actually be really preventive. And then of course, kailangan po saktong natatakpan ng ilong at ang inyong bibig, of course. And then it actually started in South Africa and then with several other variations, no? So nagba-variable po yung kanyang yung mga spikes, okay, in terms of its attachment. So it's not yet clear of the severity, although marami siyang naaapektuhan, even those that have been immunized, kay marami pa rin po nagkakasakit. So therefore, it's not because of the vaccination that you can be preventing the acquisition or the transmission, but preventing you from getting the severity of the disease. So say, for example, mild lang na-acquire mo, although you will still have the symptoms, but then it will not progress into the severity. So it's imperative that you will have to have the 2 doses of your vaccination and then of course a booster dose. No, pero nowadays with actually Omicron that is progressing and proliferating po, dumadami. No, mas marami po ang mga inaatake ng virus nito, yung mga unvaccinated. So pag yung vaccinated naaapektuhan, mas more for the unvaccinated kasi they progress into the severity of the symptoms. And even more so with the children. Ngayon po, nung this past few days, I have been receiving calls left and right po na nanghihingi po ng tulong para mapasok sila sa ospital, para and these are all children, mga toddler, and these are not vaccinated. So medyo yun po ang mahirap doon na mga kadalasan ay mga bata na po ang naapektuhan, and especially with the easing out of the IATF restrictions noong December, pati mga bata na nakakapasok sa mall or sa mga park, so they were exposed. So even yung mga vaccinated nga po ay exposed at nakakaroon ng symptom, what more yung mga unvaccinated. So but then this is actually okay, so as mentioned, okay, initial infections were from the university students, the younger individuals who tend to have more mild disease. Maybe that mild disease, but then of course, if your immune system is way too low, meaning hindi kaya ng depensahan ng katawan kahit bata, no, then you can actually succumb to diseases or severe diseases or death. Okay? So the spread, it can actually be transmitted, as mentioned, through those 3 forms. And then, of course, now they're looking at it that it can be spreading through the air, or it could be airborne. So severity depends on your immune system. So we're still actually looking into the potentials of it spreading, and then of course having all those mga unvaccinated progressing into the severest form of the COVID disease. So vaccine, still we have a very good coverage of the vaccine. So if you need to actually be getting your boosters, okay, please do, kasi importante na meron pa. Well, of course, we have to accept the fact that this is going to be our lifestyle already for the next 3 to 5 years or more. No, so yung po talaga, we will be needing some boosting every so often depending on the variant that it could be mutating into. So magbabago-bago pa yan. Ito South Africa, ngayon next time may mga iba pang mutations yan. So we'll have to live with it, but of course we have to combat it as day progresses. No? So hindi po pwede tayo magpapa gupo, no, sa disease or sa viruses na ito. While we have tools to fight the Omicron, of course, definitely vaccines and your boosters. And then, of course, you have to be fully vaccinated. And if you have some people around you, no, medyo hindi naniniwala na so far yung mga taong nakita ko, hindi naniniwala sa mga vaccinations. I'm sorry to say that, I felt bad for them that they all went already. I mean, nangamatay na yung iba na naalam ko na hindi naniniwala sa bakuna. Oo. So sad to say that you'll be seeing them do sa Facebook. I'm not saying it's a guarantee or an absolute guarantee, but at least, no po, medyo tayong may kaunting depensa o panlaban sa virus. Okay? Then mask is important. Hindi po siya parang pang-display or hindi lang din po siya parang pang-fashion or what. It's not a statement. It's your protection and also protection for people. You might be transmitting it eh. Pag hindi ka naka-mask, okay, you wouldn't even know that you are the one killing that person when you have acquired it and you're transmitting it, especially in your family. Baka kaya mo, oo, pwede. Bata ka eh. But of course, since sabi mo, labas ka ng labas, okay, dahil of course bata ka, you can actually be battling it out with that virus. Pero pag uwi mo, andyan ang lola mo, ang nanay mo, ang tatay mo, or any of your brothers and sisters that are immunocompromised, baka hindi nila kayanin. So definitely you have to wear mask. And nowadays, really, it's important to have a very good mask. No, of course, it's terribly difficult now. Okay, as I have said, hindi lang siya bacteria, hindi rin lang siya virus, pwede rin fungi or pwede rin parasites. So iba-iba yan. These are all not visible by just the naked eye. Meaning hindi siya makikita, hindi yung dumi nung nasa mask mo or yung nakikita mo na tawag tayo stain in your mask, but it's something that really cannot be seen by the naked eye. You need to have an electron. It's not just the microscope that you'll be needing for you to be able to see these agents, but these are all needing electron microscope. Mas sophisticated pa po. And then of course, pag sinabing bacteria, this is one-celled organism that can reproduce by themselves. No, they're too small to be seen by the naked eye, so it may be bigger than the virus, but then of course still is not visible. So bakit ko sinama itong bacteria? These are two that are causing almost just the same symptoms to us. Hindi mo lang alam kung bacteria or virus unless you will have to note of some differences. Now, like, okay, for bacterial infections, normally or most of the time, it's usually having a fever that is actually of a low grade than as opposed to a virus. Usually, pag viral, mataas yan, 38, 39, 40, 41, of course. And then, of course, pag halimbawa sa phlegm, meron din tayong difference into that. Okay, so say, for example, pag viral, whitish phlegm. Pag bacterial, usually yellowish to greenish phlegm. So depending on the causative or yung etiologic agent or yung depende dun sa microbio. So that's actually your bacteria, and then it has this structure. Okay, so the only thing that makes it resistant to most of our antibiotics are because of the structures. So you may see here that you have a plasma membrane, the one that encloses the genetic material, which is the DNA, no? And then of course it has also the cell wall and the capsule, the cell wall and the capsule. Okay, yung po yun, kapag bibili kayo ng antibiotic na hindi po empiric para doon sa bacteria na kung ano meron kayo, magkakaroon po ng resistance. Yung tinatawag nating resistance. Halimbawa may TB bacilli kayo, which is actually bacterial, no? Tapos ang ininom mo lang ay amoxicillin dahil akala mo yung ubo mo ay parang ordinary cough lang. Then next time that you will be taking this amoxicillin, hindi na po tatalab sa inyo. But of course, there is an empiric drug for an TB, no? Tuberculosis TB bacilli, no? So kailangan po yan yung isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin. So yun po yung mga gamot doon. So kailangan po to tukoy natin kung ano po yung talagang mikrobyo. Hindi po nagle-left and right bacterial or antibiotic na gamot. No? And then meron kang virus pero ang tinitreat mo antibiotic. Hindi po. Antibiotic para sa bacteria, antiviral drug para sa virus. So there is always that need to know which one is causing you. And then of course, pero minsan kasi pareho lang sila ng simptoma. Ngayon sabi ko sa million of viruses and then of course the several hundreds of thousands of bacteria, halos pareho ng simptoma, alangan naman magpa-swab ka every now and then. And that would cause you several, that would entail some amount, no? So medyo magastos. But of course, when you know that your causative is this and that, more or less, alam mo yung paano gagamutin or ititreat, no? Of course, the virus, as I have said, they cannot replicate by themselves. They need to go inside us, okay, to multiply inside our cell. So pag hindi niya nagawa yun, hindi siya multiply or hindi siya dadami. But of course, when it has invaded your cell, papatay niya yung cell or even yung organs, especially say for example in the lungs. So kaya nga naglo-lobar pneumonia. Nagkakaroon po ng buong lobes, left and right lobes ng lungs natin ay napupunuan ng mga viruses and then nagtutubig, di ba po? Nagko-congest and making it difficult for all of us to breathe in and out. So pag may tubig ang lungs, hindi po papasok ang hangin. May hirapan kang huminga and medyo parang nalulunod po ang pakiramdam niyan. Kaya of course, you don't want that to happen. That's why you have to be preventive, okay? So this is how it looks, okay, under electron microscope. Ang ganda-ganda niya, but of course, it's actually lethal and devastating. It can create havoc. Sobrang pwede siyang pumatay. We've had, okay, these viruses, you have heard them, okay, from the news, okay, you may have read this from the dailies, no po. Lahat po ito nakakos na ng mga severe infections sa ating katawan. Of course, you may have heard of HIV, hepatitis, Ebola virus. These are all viruses na talagang pumapatay po sa ating mga cells and tissues. As I have mentioned, that the glycoprotein or the spike protein is the far more important structure now for the variants into mutation. Okay? Ito, di ba po yung sinabi ko sa inyo before that it would be attaching at the knob. Okay? So bago siya pumasok sa ating cell, pupunta siya sa knob, doorknob, which is the receptor site. Kailangan po ng receptor site para po kumapit itong virus. Ngayon, since ang dami na natin mga immunizations, of course, hindi na niya tinatanggap yan yung spike proteins. Ngayon, si glycoprotein po has to mutate or to transform or to actually modify itself para of course maka-attach pa siya at makapasok pa rin sa ating cells. Ngayon po, yan po yung mga pinag-uubisahan ng variations natin or variants that we call. Okay, so this is our cell with all its complex organellar structure. Ito po ay importante na lahat po ay present and then of course functional. But later on, when you are invaded by a virus, okay, ito po ay mamamatay until later on it will have a cascade of all these mga deleterious effects to all our tissues and organs until you will have death. Okay, so portal of entry is important for you to have an infection. Ano po ba yung sinabing portal? Okay, it's the opening or to where it actually goes in to into our system, into our body. So the nares or the nostril is actually the area of entry ng lahat ng mga viral airborne or droplets or that are being transmitted. May umubo, may sumipon, may sumingha, may nagsalita, no? Of course, may kumanta, lahat po yan papasok sa nostril. And this is our nasopharynx, okay? And then of course, we have the oropharynx. These are the layers of your pharynx. Okay, importante po kasi that, we have to know that the nasopharynx, dito umaabot yung ating pledget pag at tayo po ay sinaswab, RT-PCR, which is the gold standard. And thereafter, you can also have it in the oropharynx, medyo masuka-suka ka because of the uvula or your gag reflex, no? So medyo kailangan po kunin yan, itong dalawang area na to because dyan po pumapasok lang yung mga viruses and bacteria until it goes into our larynx until it goes down into the larynx, trachea, and then going into the bronchis and to the lobes of our lungs, the left and right lobe of the lungs. So in terms of its rate of detection, which is actually significant sa nasopharynx, yung sa pinakataas, about 46.7 or 56 out of 120 than the oropharynx. Sensitivity, mas sensitive po sa nasopharynx sa pagkolekta ng mga viruses. Okay, and then of course, compared to oropharynx, mas significant po siya. And even when you have it, okay, for the asymptomatic patients, mas mataas pa rin po ang swabbing or collection ng mga viruses sa nasopharynx than as opposed to oropharynx. Incubation period, importante din po ito because it's the time when the host got infected or when the disease actually or the symptoms of it occur. So yun yung parang na-expose ka tapos nagkaroon ka ng manifestations of yung mga symptoms, or it's the duration of the illness, okay, or the amount of time the person can be sick before recovering, or kung hindi maka-recover, that death occurs, that still is incubation period. Pandemic, it's global, it's actually universal, meaning it's the worldwide thing. So mabilis ang pag-spread and more lives are actually affected than as compared to an epidemic or sorry for the typo epidemic, and then of course the endemic or even just a sporadic term. Okay, it spreads quickly over a wide area, and it's not the first time that we're having a pandemic. So we've had notable pandemics in the past. Okay, so it's just like a notable pandemic would be a Black Death in Europe. It happened in 1347 to 51. So ilan ang mortality? 25 million. So malayo-layo pa naman tayo, but of course it's not going to it's not something that we are actually trying to we're trying to evade, or I forgot the term. There's actually term. We're trying not to have that much number of death, no? Okay, then we have had a smallpox in the 20th century, around 300 million deaths, no? So, and even if you survive, no, parang with all this disfiguring effect onto your face, your body, no, but you wouldn't want to survive, okay? Or gusto mo na lang namatay ka. Then influenza or Spanish flu, it happened in 1918 to 1919 and had 50 million deaths, and then reoccurring every now and then with several deaths occurring. So then we have had, or still, we're actually having AIDS, no, or HIV, 30 million deaths already. This is actually not updated, but then of course still is counting. So ang dami pa po ang mga hindi na-document na HIV cases na namamatay na lang, na hindi sila nagpapa-hospitalize. Now, it's important that when we talk about viruses, bacteria, and all this, we need to talk about the immune system. So in all these things that our body is trying to eradicate them, it's the immune system that does the function. We've had digestive system, cardiorespiratory system, and all those systems that we've had in elementary and high school. But then, of course, for particulars, this is actually the function of the immune system. So when we say immune systems, a complex network of cells, proteins that defends the body against infection. So it also keeps the record of every microorganism that has actually tried to enter and defeated our body, or try to recognize them and destroy them outrightly, or if you had pass, parang nakapasok ka na sa akin, hindi na kita kailangan so meron ng antibody against it, so hindi na siya makakapasok. But sana nga ganun lang sa atin sa SARS-CoV-2, no? But then of course it keeps on mutating. That's why medyo kinakapapa natin kung paano ba talaga ang antibody or complete antibody with this kind of virus. So it can lead to also some allergic reactions sa immune system, or if you have deficiencies or depletion, then you can have some manifestations of immunodeficiency sa immune system, or you may have an autoimmune disorder. So of course, one would be an example of yung ating very popular Chris Aquino was having autoimmune disease, SLE, no po? So just for example only, it's been known that she has the autoimmune disease, no? So and then of course, under the immune system, we have WBC or white blood cells. So ito yung tinitignan natin kapag may infection or inflammation. Ito po kasi yung tumataas kapag meron po noon at manifest ka ng mga signs of fever or symptoms of fever and all that, no? So it actually is important to defend the body against all these invaders. Pero pag na-overwhelm, no, okay, ng mga invaders, then of course they will mount a number of WBCs to combat it. That's why it's important to have also a very good defender or WBC. Pero of course, if you have some problems with the WBC, either mababa ang WBC nyo or you have problems with it or it's so high, then you might just have a problem. You may be vulnerable to a lot of infections with this, okay? And then this includes your lymphocytes, your B cell, T cells, and natural killer cells. Now, also antibodies. We've been hearing this left and right. It's actually the one that helps the body to fight against the microbes or the microorganisms or the toxins that it produces. So yung mga mikrobyo yan, meron din po silang mga lason na ikinakalat, and then of course that's causing the death of the cells and the tissues. So it has to be eradicated by these antibody. And then of course, usually ang mga antigens na yan or yung mga mikrobyo na yan, meron na kaakibat na mga tawag na toxins in their body. So then that's needed to be destroyed by the antibodies, the lymphatic system. So if important po yung mga WBCs, antibodies, kailangan din po yung drainage system. So it's a delicate network pag sinabing lymphatic system. So this is where it all drains. Kung simplihan natin, kung ang tubo ay barado or kung merong mga paninikip na mga pagdaloy na mga tubo, definitely lalaki yung mga nodes na nandoon. No? And then of course, yung nodes na tinatawag natin, yung kulani, it actually sequesters. It tries to remove all the debris materials, yung mga foreign body, bacteria, viruses, doon. Kaya pag merong infection, kaya pag kinapa mo, meron pong pamamaga ng mga kulani, lymphadenitis, no? Or lymphadenopathies. So pag medyo may bara, definitely makikita doon sa mga tubo, and then at the same time magmamanifest doon sa mga kulani. And then we have that all over our body. So it's part of our immune system. So it's important that you have a very good lymphatic system that actually manages your fluid level. So if you have congestion, kasi we all need water at 70 to 80%, right? But then of course, when we have too much of it, it has to be drained. It has to be excreted out of our system through the urologic system or yung ating urinary system, right? Okay, but then of course, when you have a lot of bacteria, it also drains this through the lymphatic system. Meron ka mga cancer cells that will have to be drained also, and sometimes you would palpate it kung meron kang cancer sa suso na nagmetastasize o kumalat na, unang kinakapa natin would be at the armpit or the axillary na merong mga lymph nodes doon, no? Magkakaroon ng lymphadenopathies. That would actually be very important in the staging of your cancer. So deal with the cell products that would result to disease or disorders, and also some fats. When you have too much of it, it has to be drained. But when it gets overwhelmed, sobrang dami ng taba na kinain natin nung Pasko, so definitely it will be manifesting into, well, of course, an overt na paglaki ng ating katawan. So yan po yun. Then of course, ang lymphatic system is made of lymph nodes or lymph glands, yung kulani. Okay, and then also it has a lymph vessel, which is a colorless fluid that bathes the body, and then of course it drains the all the infections, and then it carries with it WBC or the lymphocytes. Ito po ang struktura ng buong lymphatic system that actually is important for the immune system. So we have the likes of the tonsils that drains all the infections when we get tonsillitis. You have your thymus gland, your lymph nodes, your lymphatic vessels, even your liver. It actually is the one that siya po yung sumasala ng ating mga kinakain, iniinom, that when you have too much of fats, then you get a fatty liver. Or when you eat a lot of mga toxins, okay, that would be deteriorating, that would lead to the deterioration of your liver. That's why you need to detoxify. And then of course, marami pong iniinom na gamot. Then of course, it will actually go into the first pass effect na tinatawag. And then of course, liver is the one that is actually straining or draining all of that. So yung spleen, yung Peyer's patches ng ating mga small intestines, your appendix, no? And then the bone marrow. So sometimes may mga na-operahan, tinatanggal yung tonsils or yung appendix, okay, bumabawas po sa ating mga immune system ability to actually drain, okay, our bodies, foreign bodies, no? And then of course, also when you get some bone marrow affectation, say for example, okay, this is your bone marrow, a cross section of that, okay? Ang mga parts dito would be your RBC that are being produced and WBC as well as the platelets. So kung kailangan po ang inyong bone marrow magtataglay ng ito mga cells na ito, it has to have the full amount, no? But then of course it can also deteriorate as we age or when you have a disease. So red blood cell, importante yan para sa hemoglobin that carries oxygen within our body to the lungs and every part of the body. So, and then WBC for fighting infections and also for platelets for preventing the bleeding, no? So may clotting mechanism po ang platelets natin. So now, if and when, okay, say you have your bone marrow got afflicted by the COVID virus, ito po yung itsura. So it's no longer able to produce the RBC, WBC, and the platelets, and worse is then you get the symptoms of all the depletions in any of these cells. No? So kung halimbawa RBC producing oxygen for hemoglobin, then you will run out of that and then making it also difficult for you to breathe and to have a very good oxygen exchange. No po? And then of course, you might have bleeding tendencies dahil mababa din ang platelets, and then the WBC is surgingly high because of the infection. Now, also another part is your thymus that filters the blood and also produces the WBC T lymphocyte or the thymus lymphocyte. So apart from those mentioned in the lymphatic system, okay, and then all those organs that I mentioned, we also have other defense against microbes like the skin. So it's like 2 square feet of that, okay, pag tinanggal mo lahat ng skin, pag pinagsama-sama, that actually is preventing disease from invading our body. The lungs, the digestive tract, okay, and also the body fluids, the oil, the saliva, and tears. No, of course, there are those patients that comes to us, masyado daw silang oily and all that, but sometimes we don't really eradicate it too much because you don't have a defense anymore. So that, of course, pag tinanggal mo yung oil mo, of course, a lot of microorganisms of foreign bodies could actually be invading you already, even the saliva and the tears. Okay. So everything has a purpose. All I'm saying that we need to have, okay, an idea of all these things before we could actually be digesting kung ano yung ating pinag-uusapan. Of course, fever. It's not all bad at all times. No, fever is a signaling mechanism. So pag may fever ka, may infection, may inflammation. So and then of course, yung immune system mo ay nagre-responde dahil merong foreign body or infection that goes or is happening inside your body. So it could actually be killing some of the microorganisms, those that are actually just that can be eradicated by just an increase in temperature, right? Okay, so other disorders of the immune system. One is allergic disease. So if you have a lot of immune system problems or very immune deficient, okay, then you can have allergic reactions. And where do we get all these allergies? From food, from medications or a sting of the bee or say other mga animals or insects rather. Then anaphylaxis, which is actually an immediate, not immediate allergic sensitivity that can cause you death. Pwede immediate na magkakaroon kang bronchoconstriction and then of course respiratory arrest, then cardiorespiratory arrest. Allergic rhinitis, if your immune system, one way of assessing if you are constantly having a lot of allergies, then actually your immune system is way, way low. Okay, so allergic rhinitis due to allergens or pollens, then you get you sneeze every day, especially in the morning. Sinusitis, asthma, hives, dermatitis, eczema, hives yung pamamantal po. Opo, these are actually allergic diseases that you have a disorder in your immune system. There is what we call also as an autoimmune disease, which is an immune problem. Okay, it is it is the one that mounts a response against your normal body component. It's like, okay, your body in the cells are competing with each other, trying to outlast each one. So kaya nagkakamatayan yung cells because there's something that is actually innate in you that's causing it to deteriorate. So ito yung mga kagaya ng multiple sclerosis, autoimmune thyroid disease, okay, diabetes type 1, SLE, rheumatoid arthritis, and systemic vasculitis. Okay, so when you have the word immunodeficiency, meaning from the word in itself, you have a deficiency in your immune system, or you may have an underactivity of your immune system. It could be inherited, it could be resulting from a medical treatment. So if you are actually constantly into a lot of steroids, and then of course, since you have a lot of medications also that can cause you some immunodeficiency. And then of course caused by another disease. So meron tayo mga diseases that could later on can make you immunodeficient or more vulnerable to infection. Now, say there are 6 signs that you have a very weak immune system, of course, or 6 signs that will make you having a deficient immune system. One, you have a stress level that is sky high. So, of course, December, ang dami nating puproblemahin, lahat ng bibigyan ng mga regalo and all that. So, trabaho and things that happens during the holiday season. Always having a cold, no? And then now, medyo okay, parang medyo forgivable, though hindi talaga dapat nagkakaroon ng colds kasi syempre the change of weather could actually be a contributory factor to it, no? So, but then of course, when you have a very good immune system, the colds should not be there. Okay, so when you have tummy troubles, you have dyspepsia, you have gastritis, gastroenteritis, or yung meron pang mga trouble with, okay, their defecation. Okay, so when, okay, loose bowel or minsan, was it constipated? Oo. Minsan palitan ng ganon, so then you have that problem, then you probably are stressed. Or when you have a stress diarrhea, that is really typical of those that are really stressed, no? So yung bigla ka nalang natatai ng liquid, of course, because of too much stress. Okay, so your wounds are slow to heal. So you have to also rule out if whether you have, okay, some other disorders, or say for example you have cancer, or when you have diabetes, when the wounds does not heal or coaptate, hindi po siya nagdidikit or naggasasara. And then of course, if you have also some problems with the bleeding, no, you have bleeding tendencies, so nagkasugat, laceration, hindi siya nagko-coaptate or nag-stop, then you have to rule that out also. And then of course, have frequent infections. So lahat ng mga ITs, tonsillitis, pharyngitis, laryngitis, lahat na ng mga ITs that you constantly would acquire infections, ibig sabihin, the body is not capable of actually preventing you from getting all these diseases. Okay, and you always feel tired all the time, even when you have just slept, or parang aandap-andap, okay, parating constantly pagod ang dating kahit na kagigising lang po. So that's these are the signs that you are really that you have a very weak immune system. So way to boost it definitely by having a balanced diet. So what is balance? Of course, you just have to have vegetable, half of your plate, and then carbohydrates and proteins. So optional will be the fats, yun po. So then of course, getting enough sleep, of course, at least 6 to 8 hours in a day. Opo, na dire-diretso. Hindi po kasama doon yung halimbawa every 2 hours ihi ka lang ihi, baka may problema pang iba. Okay, so kailangan po diretsong sleep. Okay, hindi yung natulog lang, gigising ng madaling araw, isipin yung mga babayarin. Okay, meral po si Judith. And then of course, yung washing of hands, exercising regularly o ngayon. So parang New Year's resolution, ito naman talaga every January, magpapapayat na ako. Of course, it's not actually pagpapapayat, it's actually more of boosting your metabolism. So it's actually a way of life. It should be, no, coming from me, believe me, I actually regretted for the longest time already. So kailangan po natin at least 30 to 45 minutes of exercises at least 3 to 4 times a week. Regretted, but of course, actually medyo ano naman ako, compensated in the sense. But of course, syempre, when we are actually in the medical field, so medyo talagang ang hirap po mag-exercise at the same time to have a very good balanced diet and enough sleep. No? Medyo kaya ito, ending, ayan. Yan po. So washing of hands at least 20 seconds a day. So with a very good soap. A good soap is something that of course hindi po kailangan sa abonera na nakababad sa tubig. So the more that there is moisture there, the more the microorganisms are actually loving it there. So it has to be talagang drained, or if not, you can have the one that squirts in the pump. Okay, yun po mas maganda. Okay, keep with your vaccines. So keep up with your vaccines. That definitely no for those who are actually, especially the old age, no, and then of course those who are immunocompromised, as well as those who have comorbidities, yung may mga hypertension, diabetes, kailangan po yan may bakuna po. Apart from you being just a regular, meaning walang mga kahit anong problema, so everyone has to have the vaccines. And then, of course, have your booster shots. Okay, maintain a healthy weight. Okay, so you know your ideal body weight, and then, of course, you maintain that at least. Okay, when you are actually maintaining that, you are more certain that hindi ka magkakaroon ng of course other diseases, kasi if you're not actually obese, then of course then wala ka yung mga problems for obesity like diabetes, hypertension, cholesterolemia and all that. Okay, so smoking, my goodness, of course, no, wag na po tayo mag-smoke. If ever po makakasabi or makakapagsabi kayo sa mga asawa, kapatid, or kahit sinong mga close sa inyo, or not even those that are close to you, please, wala po talagang benepisyo ang smoking. So, madali lang daw po sa kanila mag-poop, and then go for some laxatives. Go for some papaya or yung mga tamarin, ganyan, kesa yung mag-smoke. That would be deleterious to your body. And of course, minimizing stress. Okay, so sabi nga nila, okay, this time of the year, I'm not going to be stressed. Okay, and then dumating si Judith, anak ko, na-stress na naman. Of course, let the stress, stress themselves to you, but not yourself. Don't stress yourself. Okay. Immunomodulators. Okay, ito yung parang pang-boost ng ating immune system. So our body as we age also goes into deteriorations. Meron degenerative process din po. Bumababa din po ang lahat ng kung anong meron tayo. Minsan pa nga nawawala. Of course, no? So kailangan po natin ng modulators in the form of these supplement that we're going to be talking about. So it could be stimulant or a suppressant. Of course, we're not going to be talking about suppressants because it's more for the those who underwent transplant. So ang ating po ay ang stimulant on how it could actually be benefiting us in enhancing our defense mechanism against other infection or inflammation, even cancer. No? So, and then of course microbes. So these are actually, well, it could be, as mentioned, stimulant or suppressant, or adjuvant. Ano ba yung adjuvant? Eh, bakunado na po ako eh. Okay na, hindi ko na kailangan yung Alta Immune. No? Of course, hindi. Of course, with all these variations, you need this because it can totally eradicate or prevent it from inoculation. So, and then of course, it actually will boost your immune system that you need it. No? So, gaano ba katagal? Okay, 2 to 3 months after you have the injection, that's the time that you will have for a second dosing or boosting. Or 2 to 3 weeks after you have your initial dose of vaccine, that's the time it will actually be what? Able to form an antibody against all these viruses. So then, of course, at that time when you are formulating or waiting for your antibody against COVID, then you can supplement by dropping this particular immunomodulator that we're going to talk about. Okay, usually it's plant derived that as compared to synthetic ones, there is always and will be a synthetic effect, meaning a side effect. So wala po talagang 100% safe in all these things, like okay, especially for synthetics that are chemicals. So of course, this one that we're talking, an immunomodulator coming or derived from plants, are far more better than having synthetics. Okay, so it is actually made use due to its practical way of actually solving our problems, and it actually gained its interest in the last decades because they provide inexpensive and less toxic products than compared to synthetics. Okay, this is what we're talking about. Okay, supplement that is actually non-synthetic, all organic. Okay, and then of course it's plant derived. It's the essential oil that we're talking about, which is the Alta Immune. Lump into this, okay, that's actually able to eradicate, is able to actually prevent its inoculation from the outside exposure and then going into the cell, and then of course it prevents also the progression from mild to, say for example, when you have acquired the symptom, no, and then of course prevents it from progressing from mild to moderate or from moderate to severe. Okay. Ano ba yung mga active ingredients? Of course, it's important. So the reason why I actually gravitated towards these, no, of course, since I'm a believer of, botanicals, the essential oils and all that. So sabi ko nga, nung nakita ko, these are not actually, something that is new to me. And even to some people, hindi ito bago, like the ginger, luya. So who would not know of ginger? Turmeric, the oregano, the thyme. So lahat ito ginagamit natin sa pagluluto. The oregano, some of you may have used this, okay, for some cough problems, di ba po? Yung cinnamon, medyo okay, yeah, of course, sabi niyo, ano yung cinnamon? Of course, this is what we actually eat out, okay, pag kumakain tayo sa mga to coffee shops, di ba? And there are bake shops, okay? Then we have the sage, the basil, of course, ravensara. Okay, amongst these, okay, the sage is not too popular, but then of course, basil is definitely known to all of us. Okay, so, and then of course, ravensara is, of course, syempre parang bago din lang yan. Okay, so, but then, frankincense, peppermint, and clove. Okay, so peppermint, we've known of this. Frankincense is so extensive. It definitely, when I went to Greece, ito po, sinabi ko, I have to really look for frankincense. And these are all just the active ingredients. My God, ito lang po siya. So hindi pwede siyang imenos, pero because ang laki ng potential niya to be helping us out eradicating all these viruses, bacteria, and all that. So I further on this, as I mentioned, that I actually learned about that these three were already in the Bible ever since. So even before Christ, so, and they made use of the frankincense, the cinnamon, the hyssop, or the oregano now. Okay, frankincense, so we just had Christmas. No po, of course, frankincense is one of those gifts that were given by the three wise men to Jesus Christ. And for it to be what in the equation, frankincense, gold, and myrrh, my God. So parang, yeah, what is in it? What's in it for it to be actually equated in that level? To be given to Jesus Christ during his birth. No? So let's talk about that. Okay, 33 specific essential oils that were actually being mentioned in the Bible, and topmost would be the frankincense that was actually stipulated or is mentioned 68 times in the scriptures in Psalms, in Proverbs, Isaiah, and Hebrews. Okay, so if you may want to get the screenshot of this and then try to look for the veracity of this statement of whether there is this kind of mention of the frankincense, please do. And then, of course, it's the king of all the oils. It was used as a component for the holy incense. Okay, so, and then, of course, as a gift to baby Jesus. And then, of course, well, of course, it's actually equated in all those three gifts. Okay. And then, of course, this is how it looks. Okay. The resin of that is the one that is being used with its active ingredient or component, the alpha philandrines, the alpha togene, and the alpha pinene. So what are the properties of all this in frankincense? It's immunostimulant, stimulates your immune system, anti-inflammatory, anti-cancer, antidepressant, restorative. So all the rest you can actually, these are all self-explanatory in the sense, antidepressant, of course, when somebody is sick, so definitely all the neurohormonals would also go down, making you depressed. Wala pong natutuwa or nagsasaya na may sakit. So it goes down. Of course, you just having the thought of being sick makes you so depressed. And apart from that, the hormones also goes down. So then you have frankincense to help you boost that out. Of course, it's being used for a lot of immune system problems, autoimmune disorders, and the death of the cells. Normally, lahat po ng cells po natin ay may lifespan. Merong tanning din po yan. For the skin, it's 24 to 28 days. But then, of course, for prolonging its longevity, medyo you can have this boosting the cell in all organs that we have in the body. Congestion, of course, when you have a lot of fluids that making you congest, okay, then you have to really excrete that out. And you have no way of actually excreting them out, okay? But then, of course, you can just have the frankincense to help you out. Calf allergies, cancers, and seizures are all there for this particular. Now, the second one is cinnamon. Okay, it's actually being used for the anointing. No, di ba yung tinatawag na anointing of the sick, anointing of the pa yung isa? There's one other way of anointing. So it's actually mentioned in the Proverbs. So this is how it looks. And then, of course, it is actually the bark of that cinnamon that is being used that contains the cinnamaldehyde, the eugenol, and the phenol. So these are all being used for all these properties, no, like antiviral, fungal, antimicrobial, antiseptic, now for disinfection, antioxidant. So of course, we are all exposed to a lot of oxidation. When we say oxidation, okay, our cells, in our cells po, meron po doon yung cell na complete and incomplete, meaning yung kanyang molecule has an incomplete na ion, so then it will try to grab it from one that has complete to make the cell complete. And in effect, okay, the one that was the one cell that was stolen of one ion, mamamatay siya. So then, of course, to prevent that, we need the antioxidant property of the cinnamon to actually make all the cells balance and equal. Aphrodisiac, of course, it's an additional thing that actually increases your stamina. And then, of course, your that's actually, well, of course, you can actually further on this when you will have to be going for Alta Ultima. Okay. And then, of course, it's being used for colds and of course for flu, muscle aches and pain, oral health, fungus, and bacteria. So the difference between the cold and the flu is far more graver in terms of fever, headache, chills, fatigue, and weakness. Ang tawag nito, mas malala than as compared to just colds when you have, okay, runny nose, sore throat, or cough. Huh? So yun po yung difference between the in the houses, and also during the time when Christ was crucified. Okay, the soldiers made use of these particular stock of the hyssop that actually attaches the sponge with the wine vinegar onto it, okay, for Christ to actually sip because he was thirsty. So yan po. Okay, it was actually mentioned in Psalms, and then of course in a lot of Bible books, okay, or verses, okay, in Exodus, Leviticus, then also Numbers, as well as in John and some others. Okay, it's actually known as Origanum vulgare or wild oregano. Okay, so that's the hyssop or hyssop, and it's being used into a lot of mga concerns or problems like lung conditions, including asthma, pneumonia, bronchitis, sinusitis, and cough. Okay, so it's being long been used rather, and then of course it's used for the leaves is the one that is used for steam distillation. The carbacrol is the active ingredient, and then all the same properties at those as similar to that of the cinnamon. Okay, plus of course anti-parasitic, meaning okay, so if you have okay a lot of mga helminths or mga ascaris, then of course those who are actually fond of eating mga raw meat, say for example the sashimi or the sushi, then that can actually be good for you. No? And then those that are resistant to some antibiotic. Okay, so it's being used for some viral and bacterial infections. Okay, a lot of inflammations, and then of course, those that are resistant to methicillin, and then of course those who have canker sores or some ulcerations in the mouth. They have used this in combination with some anti-TB drugs. Okay, so it's actually being used for tuberculosis. No, basil. Okay, so this is actually containing linalool, methylcavicol, eugenol. So almost the same properties. Okay, you will notice that they have almost just the same properties because they're all lumped together due to its similar or synergistic effect, meaning they're not contraindicating each other. So when say one has surpassed this active ingredient, another active ingredient will be able to combat it once actually nakapasok yung viruses or bacteria. So one thing here, it has okay regenerative capacity. It regenerates your cell. It is also antibacterial in property, being a steroidal, meaning it actually is preventing inflammation. It actually tones and soothes your neural cells, okay, you're from the brain and the spinal cord, and then of course stimulant and also digestive also. Now the caution is for those who are actually pregnant and having epilepsy onto this, because there wasn't much of a study that was actually conducted. And normally for the pregnant moms, you don't normally test them for something else to the point of compromising the fetus, no? So what basil does is that it actually is used for loss of sense of smell, anosmia, which actually is commonly complained of by those who have COVID or those who are infected with COVID because of the nerve affectation. So then of course, clove, it's this one contains the eugenol, almost just the same for its properties, but then it has regenerative as well and vermicidal. Now vermicidal because it actually is for helminths or those that are actually, I mean, the same as parasitic, no? Okay, so you may mga ascaris and all that, and some of these flatworms or tapeworms. It has a very good aura capacity. It's a good antioxidant. So and it's also good for as an essential oil. So immune boosting for a lot of all infections. Ginger. Okay, so this is actually containing alpha zingiberine, which is for decongestion. When you have inflammation, yung mga lola at lola natin na naghahaplas sa kanilang mga tuhod, inflamed, okay, because of the bursa is inflamed. And then yung tinatawag nating bursitis, marami pong mga inflammatory cells sa tuhod nila, ina-apply nila po yan. No po? So yung luya na yan has the decongesting property, anti-inflam, at the same time analgesic. Kaya po pag hinaplas niya, nawawala po yung sakit ng kanyang mga kasukasuan, and then of course yung inflammation nawawala or nagsasubside, and of course the inflammatory cells and fluids bumababa. So, ginagamit din po yan sa ating paghilab sa mga chance, so antispasm, stimulant, laxative. Okay, so if you've noticed, if you're drinking this, okay, luya, or kung nagsasalabat kayo, it has a laxative effect. So those who are actually having problems with smoking, not able to eradicate, just alone, okay, luya could eradicate your disability to poop or to defecate, no? So, and then of course, it's good to soothe or tone your nervous system. Okay, peppermint. Okay, so this contains menthol, menthone, alpha-pinene, and beta-pinenes, and menthol acetate or acetate. Okay, so similar properties, but one thing, it's actually a vasoconstrictor, especially for those who have some problems with their bleeding tendencies. Okay, it's good for also pain relief, and then of course as an expectorant. Okay, expectorant when you have phlegm that needs to be excreted out of your lungs. Okay, it expectorates, makes you to express or to remove it. Okay, to cough it out, no? Okay, and then of course it has used for fever, allergies, and hives. Now, all along with that, okay, fever, plus of course those that we have had, okay, other ingredients that were mentioned. So since there was, okay, at this point na medyo nakakaproblema with a certain paracetamol brand, although there are other brands there. Okay, here, when you use this, okay, you don't need to have, unless it's actually overtly too high, then of course it lyses out the fever, it lowers down the temperature. So with this peppermint, okay? Then headaches, migraines, asthma, and so on and so forth. Also for the loss of sense of smell. Pwedeng iinom lang, sandali lang. 2 minutes lang po, ha? Okay. Ate Jo, water.
Kinauhaw na po si Dr. James. Kasi syempre, ang dami niyang ang dami po niyang information na ibinigay sa atin before fully discussing about our product ng Alta Immune, di ba? So, importante kasi na maintindihan po natin kung ano yung virus na yan na sinasabi natin. So, yun nga, sinasabi po niya na it is a variant ng COVID. No? So, hindi siya another virus, but it's a variant. Kumbaga, another flavor ng COVID-19, which is parang mas mabilis ang kanyang pag-transmit eh. So dapat po kami po dito sa office parang every 2 or 4 hours we're taking Alta Immune para syempre mas maging safe po tayo. And don't forget na atin pula isuot or wear our mask all the time, especially kung meron tayong mga katabi o may kausap. Huwag pong kakalimutan na isuot ang mask. Okay, so ayan na si Dr. Jane.
Sorry, alam mo naman, tumatanda, kailangan
yes, hindi po. Kasi syempre, continuously, you're talking for about 1 hour. More than 1
I see.
hour.
Oo
Yes.
nga. Ay, nako, I love talking. Kaya lang. O, sige, thank you. Ha, pasensya na. Ayan. Of course, so where was I? So loss of sense of smell. So if and when normally kaya tayo nag-anosmia or loss of sense of smell kapag may virus, syempre, di ba, pumasok sa nasopharynx, and sometimes that would inoculate in some other tissues and nerves, no, pati yung ating mga olfactory nerve, no, sa brain. pwede pong maapektuhan. Kaya po nagkaka-anosmia. Yung iba nawawalan pa nga ng ability to talk or to phonate, no? So, anosmia, ageusia, wala rin sense of what's this? Taste. Walang panlasa, no? So yan, that could be eradicated by just having, okay, the peppermint, no? Okay. So yan. Ravensara aromatica. Okay, it has alpha-pinene also and then cineol. So you will see that, okay, the active ingredients are almost similar but very peculiar. So medyo meron siyang ability that, you know, one other ingredient is not able to do. No, meron siya parang specialization in that sense, no? Here, it can actually be used rather as an expectorant also. And then, of course, it has also a muscle and analgesic property, muscle relaxant and also analgesic property. So if and when normally pag may sakit ka, may lagnat ka, lahat ng mga kasukasuan masakit, no? It actually relaxes your muscle and then of course it lies away the pain. Kaya nga siya analgesic. So yun yung kagandahan nito ng Ravensara. So it's actually being used for chills and flu, whooping cough, bronchitis. See this, okay, itong apat na ito, so pag meron kang colds or flu, no, and then of course you have cough as a manifestation, it can actually try to address that problem already, apart from its ability to actually control the microbes, no, the germs, and then of course the muscle and the joint pain. So meron siyang specific use for it being lumped all together. So now we have the sage, which is actually almost just of the same properties that the other active ingredients that we have, but of course it has tonic ability, meaning when you're tense and all that, pag lagnat ka, may lagnat ka and all, your nervous system is also far more agitated, no? So pati parang you're so restless, you're so what's this? Yung parang you're so agitated, anything that could trigger you will trigger you and make you feel really bad. Diba? Just the noise or just the, say for example, whatever that could makes you agitate, then of course with just this sage, it will try to normalize or balance off your energy, your nervous system, and all that makes you feel that you are actually just okay. No? Yun yung kagandahan ng sage. And then it has also cineol, camphor, okay, and then of course it has antifungal property. So it's being used for a lot of similar other properties or concerns rather, but then of course it has a very good bronchodilatory activity, especially for those having concerns of okay coughing, and at the same time they have bronchoconstriction. So it actually, pag bronchoconstricted ang inyong lungs, okay, then this will try to dilate the bronchus or the bronchi, so making the air go in and out. So that's the bronchodilatory activity. So ito naman ang kanyang specialization. Kumbaga, if you're going to look into all the properties and then of course the usage of all these particular active ingredients, may kanya-kanya siyang specific na function. Okay? And let's go about let's go to time. Of course, it has a thymol, terpinenferol, and then of course, it's also mucolytic naman. Ano ba yung mucolytic? Di ba minsan merong mahirap ang paghinga dahil of course constricted. Pero kahit na ma-dilate mo yung bronchi niya para mag-go in and out yung hangin, pero kung ang kanyang mucus naman is very sticky and congesting and then blocking, say for example, yung mga alveolus or yung mga bronchi or bronchioles, okay? So, kailangan din po i-eradicate or i-liquefy mucolytic mucus, ilalize niya or para tutunawin ng phlegm. So para mabilis ang pag-expectorate niya or paglabas ng phlegma sa katawan. Kasi po pag hindi mo in-address kung ano yung root problem, kumbaga kung ang problem ay ang mucus that is so sticky, nakakapit na phlegma, then that's a problem. Or kung medyo liquefy mo man yun, pero ang bronchus mo medyo constricted, that will be another problem. Or the ability to expectorate it, then you need to have expectorant. Di ba po? Yun po yung mga ina-address nito. So kanya-kanya po silang properties and specific actions, no? And then of course the same for doc uses, and then of course it's being used for viruses, flu, asthma, croup, or the what do you call that, what's this, the hard cough, no? And then of course some pneumonia. Okay, and then of course it decongests, and also it's actually good for fatigue, stress, and depression, no? Turmeric, curcuma longa. So of course, luyang dilaw contains artemerone. So apart from all those mentioned known properties similar to the active ingredients, other active ingredients, it has anti-carcinogenic property. Ito naman yung kakaiba sa kanya. So for cancer, as I have said, that of course we're all exposed to a lot of oxidant or free radicals. No, of course, and then all of us have cancer cells that are just waiting for it to be triggered. So pag na-trigger yan, of course, cancer cells mahirap pong i-stop during its division. Pag na-trigger na siya, continuously multiplying, dividing, and that's how cancer cell is progressing. So when that is actually apparent, or then of course, you can be preventive by having turmeric. Ito po yung magpe-prevent siya na ma-stimulate yung cancer cells, or even if you're exposed to a lot of free radicals, it will actually prevent all these mutations of the cancer cell. And then of course, anti-mutagenic nga po siya. So it prevents the mutation, and then anti-tumor, no? Pag form ng mga tumor o bukol-bukol sa ating katawan. It also is good for detoxification and also decongestion. Sabi ko nga sa inyo, pag congested ang ating mga lymphatic system, bumabara ang magkukulan and all that. So definitely you have manifestations of weight gain without you knowing that actually is due to the congestion or fluid accumulation. And later on, that could make you congest and having some inflammation, lung inhalation and exhalation capacity. So mahihirapan kang huminga. Feeling mo nalulunod ka. So that you need to decongest. As we age, tumatanda din po yung ating mga lymphatic tissues or lymphatic tubes, no? And then of course, that's why makikita mo minsan, manas ka sa hapon. Manas ang iyong mga paa, ang iyong binti, minsan umabot buong katawan. So you need to detoxify, you need to decongest. Okay? So pag yung liver barado din, it's actually, yun nga sabi ko, medyo konektado ho lahat yan. So pag barado na ang liver, barado na rin lahat, of course. So you need to detox and you need to decongest. And one property that could help that, or one ingredient that could help that, is through turmeric. Okay, so same properties or uses, okay, and then of course for some respiratory issues or bronchitis. Now, let's synthesize all of what we have talked about. So in the sense that the virus would always go for a receptor site or a knob ng kung duwari ito ay pinto. Ito po, for your orientation po, hindi lang po kulay ito. No po? Itong puti na to is outside of your cell, yung isang cell po. Ito yung color lilac, no? Lilac ba to? Or parang ano, ito yung color of the year, di ba? Okay, para pampaswerte. Okay, just ano lang po. Okay, so ito po ay cell nyo. Isang cell lang po ito. So of course, before a particular virus could enter, well, definitely for just better presentation lang po, it always attaches itself to a receptor site. Ito kunwari po yung doorknob. Okay, so even before a certain virus, any virus for that matter po, could be just entering into your cell. Say, for example, this is your cell in the nasopharynx, no po. So, pwede po siyang i-eradicate na ni oregano. Okay, so ito nga po yung para sa mga ubo, mga cough or colds rather, di ba po? Okay, so even before it could be entering or when it has entered, and then of course, meron pong tulong na dyan si ginger than cinnamon. So to prevent it actually from re-entering or actually really progressing inside the cell. So and then of course, ang piniprevent nito is that for it to hatch itself and to be actually having its viral RNA. Ito nga po, na-open niya na yung kanyang RNA tapos na-release and that is needed for its replication and reproduction. This is the stage where it actually replicates and then of course, so in this area, peppermint could already be eradicating these viral RNA releases and together with the turmeric, luyang dilaw, and then the sage, and then of course the basil, okay, this to prevent the multiplication and the replication. Okay, so for it to undergo active, what's this active reproduction or replication. So it replicates its RNA and translate them, okay, using the Golgi bodies until it will be what? Well, definitely the peppermint is there to always kill all outrightly kung alin bang virus ang nakapasok, no po. And then of course, later on when the Golgi has actually been used up and then it will actually release a new virion. A new virion would actually be a new virus that can actually be going out of the cell, and the minute that it goes out of the cell, that cell is already dead, no? Pinatay niya na po. So imagine it while depending ho sa number of viral load. So the more viral load, the faster is the ability to kill the body or the cells or the organs and tissues. Okay, so peppermint, and then of course just to also to have that in okay, the particular synergistic effect, the oregano, cinnamon, the thyme, and the ginger, it's actually for the attachment, prevention of the attachment and entry of all the viruses, bacteria, and other agents, no? And then once it actually goes inside the cell, it prevents its replication by having the peppermint, turmeric, the basil, the sage, and the clove. And then for it to be prevented in its release from the cell, okay, the frankincense do or does its job. So that's actually the whole scenario of all these active ingredients lumped into one bottle called Alta Immune. So basically, the same thing goes through with also the bacteria with all its properties having its ability to kill the bacteria depending on the part or the tawag nito, depending on the anatomy of the bacteria, and it's actually the resistance to, okay, a lot of antibiotics, okay. And of course we're now into um the last portions of okay, almost just at the latter part of our lecture. So, well, of course, it has immunomodulatory property and antioxidant property. So, all this will be apparent when, say, you have an infected tissue or organ system. So, when it immunomodulates, it boosts your ability to fight and combat all the infections and the agents or the microbes there. And then preventing the sequela. Kumbaga, syempre pag nagka-infection, may sequela yan, may inflammation. So the sequela of that infection, and then it prevents it from oxidization or death of the tissues or organs, no, where we have heard of apoptosis, no po. Pag kinat mo po yung iyong apple, tapos later on you see the oxidization of that particular cut or cross-section apple. So yan po din na nangyayari sa ating mga tissue. And for you to have that prevented, you need to have an antioxidant that's coming from the immunomodulatory and antioxidant property of this particular autoimmune. Apart from being antiviral, antibacterial, and anti-cancer. So I think we will all be like scared, afraid of our opponent when we don't know how to deal with it or combat these things. And then of course, it's imperative that we know. Kasi wala naman tayong alam-alam nung when it's just starting. Meaning, of course, we all just have a basic thing about virus, but then of course, when we know deeply how to actually tweak it, to twist it, to actually topple it, or to actually be eradicating it, then we can actually do um, we can actually be comfortable. But then of course we can always be comfortable if we do some preventive measures. And one way that I know that have helped me, my family, my friends, and even the not so close friends, you know uh, I have given them this, okay, to actually prevent them from actually succumbing into the depths or the severity of the whatever diseases or viruses that might just be acquired or that they can be acquiring, okay, by boosting themselves with Alta Immune. And then of course by having it 3 times a day using a 1 ml dropper. Okay, the dropper should have to have, okay, encroaching onto the rubber area, so that's 1 ml. And then you need to, when you need to go out or face a crowd, so that's actually, it's not so easy going out nowadays, no, but then of course when you have this, a certain level of protection is given to you. But of course, if you may be preventing or actually not really be mingling with a lot of people, especially you don't know if they're vaccinated or not, okay, so then might as well prevent it, okay, and then okay, you can take it before entering your house to be preventing the people inside your home, and then take it whenever when you need it, or when you're exposed to a lot of these activities that might just make you vulnerable. Okay, so it's not something that would replace your sleep, your food, your stress, or whatever. But then, of course, if you can try to minimize all those, again, then of course, by preventing, you can actually have your autoimmune as your second protection or your weapon against that. Okay, so as I have advocated it to some who have had, okay, some symptoms apparent, okay, so I actually would make them drop every hour, so back it down every hour. So I don't know how massively it is, or I don't know the viral load, okay, so, and of course I don't know how many days have already been um how many days have passed rather that they are already manifesting with the signs and symptoms. So therefore I would actually for the initial loading dose of, like, okay, those who are symptomatic, and especially those who are positive with their RT-PCR, no, and then of course they need to be just be placed in an isolation or quarantine inside their homes. I would rather that they be placed onto they be actually dropping a 1 ml every hour for 8 hours, and then of course they can revert as long as the symptom is actually regressing. And then if there's actually mild symptoms, you can actually have up until 12 hours, then every 4 hours thereafter. So you can always just consult your doctor, as mentioned by Mom Arlene, that there are those doctors already aligned. Okay, so it's not something that everyone knows about. Okay, so as we are all starting, we started way back like almost 2 years, ma'am, Arlene. Oo, so parang now the doctors are so aligned, and of course they're aware that there is this particular immune booster that can be used by most of us, or if not all of us. So I think it's important to be preventive than to actually be what, curing ourselves when we don't know what's the stage that we're in, and at the time that we cannot be actually what, halting it or actually be curing it anymore. So I guess that's just about it. So happy New Year. Thank you very much for attentively listening. Okay.
Yan. Okay, thank you very much, Dr. James Boado, for that very informative lecture, di ba? So palakpakan naman po natin si Dr.
Thank you. My
James.
pleasure po. Opo.
Yan. So anybody po from the group who wants to have a question? So meron lang isa dito. So, ano sabi dito? Anak po ng kasama ko nagkaroon ng rashes sa face, neck, and arms after lang daw po ng first dose. may tinitake daw po ito na meds para sa psoriasis. Is it contraindicated? What is your advice, Doc? Dapat po ba na itigil ang pag-inom ng Alta Immune?
Okay. I don't know what is the chief complaint muna
Yes,
nung
oo
baby.
nga.
That's why uminom siya. So I just don't know if they're treating her for this psoriasis, no? I just wanted to be clear on things kasi marami doon questions ako inire-raise sa question na yan. So if like okay, ano ba yung simptoma ng bata para uminom siya ng Alta Immune and how young is the child? And then of course, ano po ba yung kasi baka at that height that na-introduce yung Alta Immune, there is already rashes or talagang about to erupt yung rash niya. So meron po kasi iba-ibang klase ng rashes. But of course, there was a mention of psoriasis. Of course, psoriasis and then as mentioned, sabi ko, eczema, psoriasis, yung mga autoimmune na yan, okay, they can actually be prevented from actually the flares with the use of this. Opo. So, and then of course, it's not really the total cure for this kasi there are a whole gamut of mga therapeutic meds that we can be applying for mga psoriasis, eczema, and all that. But it can help by actually preventing you into going into the lows of your immune system that makes you have a flare or some ang tawag to, irritations okay during this particular height of the year, no? Kasi medyo because of the cold season, medyo of course some would have itchiness into the psoriasis. Baka nagtataon lang. It's just that okay, the psoriasis if it's there already, there are flares, there are times that when that got actually some tawag nito irritations. Oo. So sino ba yan si Kuya? Kuya, medyo hindi ko na Oo. So yun kasi because of the cold season it can actually be oo. Ano lang yung sa hangin o sige pwedeng tigda sa hangin parang ganun yata at sinasabi ni Kuya. Okay, siguro yun so just wanted to know pero of course if it will be stopped okay well yes tignan natin to see if whether that is caused by that okay autoimmune as of course we never would okay yun nga sa age pa lang hindi ko alam kung anong age no so but then of course we normally don't give it to young age bracket for reasons that of course unless there is hindi ko alam kung anong indication sa kanya bakit pinigay so yun so pero of course we don't really ano bang sabi natin doon the term is not really recommending it for the use for yung mga bata and then of course those who are pregnant and lactating so yun lang po.
Yes. Thank you for that, Dr. James Buado. No, minsan kasi siguro, alam niyo po, naki-carried away talaga tayo dun sa mga nangyayari ngayon. So, kung let's say na something happens to our body, no, na nagkaroon tayo ng sakit or let's say meron kang pre-existing diseases, tapos
Right.
nag-take ka ng Alta Immune and then nagkaroon ng parang mga reactions. So, ang tatanungin talaga, i-stop ba yon? So, let us all remember na this is a food supplement. So, sabi nga po ni Dr. James, wala tayong therapeutic claim. So, kasi nga this is still a food na hindi po talaga siya nakakagaling. So, in some cases, ito yung nagiging parang solution nila kasi when they take this kind of product, nagkaroon ng magandang effect sa kanila, di ba? But it doesn't apply to all po. So, most especially if you have pre-existing diseases, the best thing to do is to seek advice from your doctors before taking it, no? So, but then, kung wala ka naman mga pre-existing diseases, so freely you can take this, no? To boost your immune system, no? To help, no? Most especially that if you are in the, nasa stage ka na ng, yung age mo ba, parang nasa mga late 20s and up, no? It is but natural po that we take some food supplements, especially nowadays, na iba talaga yung klase ng panahon ngayon that we really have to have something, we have to take something that can help boost the immune system, di ba? Kadalasan kasi, Dok, nami-misinterpret nila na ito ba ay magaling sa ganito para sa ganito, sa mga sakit. So, always po, we have to remember this is a food supplement. It's not a medicine. No, wala pong therapeutic claims. No, those that we heard from the others na meron pong naging magandang reaction sa kanila, it's because yun po yung naging resulta by taking it na yung sa matagal ng panahon. Hindi po kasi instant ito. No, but then you can always parang sabi nga ni Dr. James, this is an adjunct no to whatever we are taking now. Kumbaga, karagdagan ito sa ating tinitake ngayon na pwedeng makatulong, which is yung pong ingredients kung atin pong napakinggan kanina, those are really for boosting the immune system, di ba? At saka pag kill ng mga viruses, ng bacteria. So lahat po doon siya naka-anchor. So in other words, wag po natin siya talagang i-misunderstood na ito ay gamot, no? So pwede po siyang isabay sa inyong mga tinitake ngayon, but you have to seek the advice of your doctors and wag pong pagsabayin ng pag-inom. You should have an interval. Kung iinom ka po ng mga pang pre-existing diseases mo, yung mga maintenance mo, ngayong ng umaga, after 2 hours, you can take Alta Immune or the Ultima or the Prima and then take ka uli. So there should have an interval. Hindi po siya pagsasabayin, no? Kaya yun po yung importante na ating tandaan, no? Kasi po siyempre katulad nung meron pong tanong dito, okay po ba ito sa inuubo at may trangkaso? So again, kung titingnan po natin kung para saan ito at kung meron ka namang tinitake na gamot din, no, especially nandyan na yung ubo, nandyan na yung trangkaso, so you should take mga meds na po para sa ubo at trangkaso. Now, if you wanted to have a supplement which is na sa pakikinig natin ay magaling ito, pwede naman po interval nyo lang. No, pero wag niyong i-expect na ito yung gagamot no doon sa mismong ubo na ngayon at trangkaso, di ba? But it will just help to boost your immune system. Hindi po yung mismong sakit na hindi po yung mismong sakit ang kanyang gagamutin, kundi ang immune system pa rin ang tinutulungan para lumakas, no? Para po yun ang lumaban sa mga sakit na magkakaroon tayo. Okay? So
Alright.
hindi po ano 'yon. Kumbaga na-overwhelmed kasi tayo sa sobrang daming natutulungan ng Alta Immune. But just one thing to remember, this is a food supplement, no? So it does not apply to all na ito ay pwede pong gumaling. But it's because natulungan ang immune system natin, no, kaya nagkaroon ng magandang resulta. Okay?
Yeah, okay, well said, Ma'am A. Marlene. Okay, let me just rephrase also some of the, those that were mentioned by Ma'am A. Oo. Kasi nga, sabi ko nga, it's not actually the cure. We're not into the claim of curing or having a therapeutic effect. Pero of course, sabi ko nga, preventive. So even before we could have or acquire the disease or if we could be having a transmission of disease, no? So hindi pa tayo nagkakaroon ng sakit, piniprevent na nating magkasakit. Because there are those really na hindi po sila nagkakasakit because they're very preventive. Pero kasi mga kadalasan po talaga that we are actually, well, let's take a look at the root cause of everything. Kahit naman po sa ating mga sakit na na-experiensya, it's either the depletion of something, a deterioration of one thing, or a degeneration of our systems. So lahat ng may kakulangan, kinakailangan po mabalanse yan. So ma-integrate yung supplementation. Kaya nga tayo may mga vitamins, minerals yan. Kasama po yan yung mga itong kagaya nitong food supplements. So it's important that we supplement because as we age, bumababa din ang ating resistensya or the ability to combat all these viruses, bacteria, even other disease. But when we have overtly yung kagaya niyan, may mga diseases na talaga, mga chronic diseases, of course, tama yung sinabi ni Ma'am A that you have to also ask your or ask the advice of your specific doctor onto these things. No? Kasi syempre, there are those that needs to really be parang i-consult sa consultant ninyo or sa inyong doctor kasi baka mamaya may contraindications to it. No, although these are all organic, sabi ko nga, and then they're all non-synthetic, okay, and then very popular oils, I mean active ingredients na po. So hindi naman talaga ganun magkakapose ng of course something deleterious. But then of course it has to be really coordinated with your consultants, especially to those who have some comorbidities or chronic problems already. Preventive, wala ka pang disease, ito yung kailangan mo. So, and you don't want to have the disease because you don't even know if whether your immune system could be able to battle it out or to actually compete with the microorganisms. Otherwise, then you will succumb to the disease. Magkakasakit ka kung hindi mo siya talaga ipiprevent. And then one at that height, of course, sabi nga ni ma'am, there are empiric drugs to already at that height. Iba po yung preventive, iba po yung promotive, iba po yung therapeutic, meaning at the height of the disease. No? So kung halimbawa sobrang taas na ng lagnat mo, hindi ka pupunta dito sa promotive na drug or preventive na drug or preventive na supplement na to actually remove your fever. Kasi apparently mataas na yung fever mo, then you have to take your antipyretics, yung mga paracetamol mo. So yun yun. And then of course, if there are some other bacteria, since hindi ka talaga nag-prevent, no, na nakapasok na sa katawan, you don't go for this preventive. Okay, you go for some empiric drug that would really definitely parang cure you on your disease. Opo. Okay, so I think that's what's important for all of us to take note of. Kasi yun po yung ating dito is to supplement whatever is depleted to boost our immune system to be able to combat and to actually be able to prevent the disease from occurring in our body. Okay? So yun po. Yes, I saw somebody that was raising his hand. I think Sir Arman ba yun? Oo.
Opo, si Sir Arman.
Oo.
Sir Arman.
Hello, ma'am.
Opo. Meron
Good
po kayong
afternoon po.
Good afternoon
May balance po akong tanong doon sa sinulat ko. Baka iulitin ko lang po, ma'am.
Sige po, nasan po? Hindi ko kasi nakita. Ano po
Opo,
yun,
baka
sir?
hindi po niyo nakita po.
Opo.
Ma'am, doon po ba sa nanginginig ang katawan paminsan-minsan, ano po ba ang applicable doon na dapat gamitin sa product ng We Provide?
Nanginginig po ang katawan.
Nanginginig.
Marami
Paminsan-minsan
kasing
po, bigla na lang pong nangangatal, pero nawawala din naman po paminsan-minsan.
Ano po ito,
Yung po ba may pasma?
manginom?
Ay,
Okay, hindi
hindi po,
kasi, oo.
Mga bata pa po siya, mga edad, mga 18 po, lalaki po.
Ano po ba ang kanyang
Okay.
line of work? Baka ano po ang kanyang line of work?
Pag minsan po ma'am ay uso po sa probinsya yung naghahakot ng palay, minsan naabutan ng pag-ulan o kaya pag minsan nagbabasketball, nakakaligo, hindi maiwasan. Yung po bagay pasma ang tawag po baga doon o yung po bagay may chance pa na mawala po yung pangangatal ng katawan?
Okay. Actually, kailangan ma-rule out po, sir, kung ano yung nagpo-cause noon. Okay. So, kailangan po talaga,
Panginginig.
oo. Pero kasi wala po talagang direct na, of course, in our study or pag-aaral or pagsusuri na, of course, yung sinasabi nila na pasma dahil sa ulan or napasma dahil sa uminom ng tubig or yung mga napasma dahil sa naligo pagkatapos magtrabaho. There's no direct correlation po eh. Pero of course, baka may something organic po na problema po doon sa bata na akala siguro nanginginig. Kasi meron po yung mga milder case na nanginginig minsan nawawala. Of course, baka minsan kasi yung parang even sa seizure na tinatawag, minsan yung natulala ka lang po. Okay, yung bata natutulala. Akala mo natutulala. Oy, natulala ka. Pero of course, that is seizure. Oo, so hindi natin alam. So kailangan talagang developmental neuro ang medyo kukonsultahin, or say an internist could do. Ano kasi 18 years old, no? Parang I think nasa pedia pa rin yan. Lalaki po. Oo. No, so pwede po na medyo makita or masuri kasi baka hindi natin alam, baka it's a way of or it's a kind of seizure. So akala minsan na natin nanginginig lang, yung pala of course having seizure. Yung natulala, pwedeng seizure. So hindi ko po masabi kung ano yan, but of course it has to be ruled out po. Kasi bakit nagkakaganon? Kasi for him to be napasmas sa palayan, gaano na ba katagal siya na nagpapalay para mapasmas siya, no? So hindi ko rin po makorelate onto that. Baka sandaling panahon pa lang siya tapos nagpaspa, or alin po ba ang ano, meron delayed onset po na seizure tinatawag. So medyo kailangan po masuri po natin kasi baka may something mas serious than that na nanginginig lang. Oo.
Opo.
Opo.
So
Okay
medyo,
po, ma'am.
opo,
Ma'am,
medyo
yung pa pong
kailangan
isa
talaga
pong
magkonsulta.
habol ko po ma'am, isa na mild stroke, yung pong katawan hindi maigalaw, ano po kaya ang applicable po doon, yung huli po kong katanungan?
Mild stroke. Okay. So if you're going to ask me kung ano po ba ang supplement na po pwede, itong Alta Immune would be preventive and to boost also their immune system. So kasi vulnerable din po yung mga na stroke na mga pasyente, and at that height since mild po, you can actually wala naman pong overt contraindications on that na para dito, no, unless of course yun yung medications that needs to be spaced apart, so para hindi naman wala naman po siyang mga direct na contraindications, or unless the doctor would say otherwise, then of course then we can stop using these, no. Pero of course for prevention of yung kanyang immune system to go down, and then that's needed for the body to be able to syempre surpass yung kanyang mga kailangan po niya kasi i-exercise yung kanyang mga katawan para medyo manumbalik yung kanyang mga residuals kung merong mga paralysis, no po. So we can actually go into that naman po, wala naman po siyang problem onto sa mga ganyang cases, especially mild. Ano pong residual niya? Ano po yung paralysis niya? Meron po ba? Meron po ba sa katawan, sa kamay, sa paa?
Bali ano lang po, hirapan po siyang lumakad at saka yung kung kamay po niya nakalaylay.
Oo, so may residual, no? So hemiparesis, so kalahati ng katawan medyo may paralysis. So gaano nakatagal po ang paralysis niya po?
Baka mga 3 to 6 months na po.
Mhm. So currently on medication po yan and therapy, no po. Oo. So
Yes.
Therapy
wala
po.
naman po, oo. Kumbaga nasa therapy stage pa siya kasi po yan na kailangan po continuously nagkakaroon siya ng physical therapy para i-exercise yung kanya mga residuals na tinatawag, yung mga kamay na medyo nakabaliko o yung paa na medyo hindi sumasabay sa paglakad. So, well, of course, have you started na painumin siya?
Alta immune po ang pwede po doon ipainom, tsaka yung mga panghaplas po na product po ng We Provide.
Yes, yung mga aromas natin, maganda po yan. Of course, especially kung may mga problems sa mga muscle spasm, or medyo kasi yung residual niya, medyo rigid yung mga muscles niyan. So if like you're going to parang do some petrissage or massaging doon sa mga parts, medyo makakatulong po. So okay po yun. Oo. Then of
Thank you
course,
po.
autoimmune to boost the immune system. Oo.
Opo. Thank you po ng
Okay.
marami, sir. Thank you po marami po,
Thank you
ma'am.
very
Okay
much.
po. Wala
Thank
ka
you
naman
very much,
po.
Dr. James, for
Yes.
accommodating those questions po nila. So meron pa dito, hi po Doc, pwede po ba ibigay ang product natin sa mga may gout?
Gouty arthritis kasi talagang medyo mataas po yung yung uric impurines nila. So of course, ang kailangan talaga dyan, merong pong empiric na gamot na talagang para dyan sa kanyang gouty arthritis. The only way that we can actually be preventing that is also to prevent those yung mga matataas na uric acid content na mga ng isda, ng mga intestines, yung mga legumes, yung mga
Lahat ng
buto-buto,
laman loob.
oo, yung mga ganun. Kasi talagang,
Bawal.
syempre, hindi makaiwas ng Pasko, no? Maski hindi naman natin alam, kari-kari, puro, ano yan, puro
Puro
mani, no?
tuwalya at
O
ano,
tuwalya at mga ganyan. So
at
medyo talagang,
buntot.
oo, yeah, so medyo, well, of course, you can actually still go for Alta-immune, but then, of course, it's not the drug for the gouty arthritis. So, meron pong i-advise ang inyong ortho or inyong internist on that para at least eradicate or yung
Ma-address.
mabawasan, oo, yung pananakit at pamamaga. Oo. So, meron po yung go to your ortho or go to your internist. Oo.
Okay, so isa pa po, Doc James. So ito na yung last natin, si Coach Jim Baha. Meron siyang nag-raise ng hand. Yes, Coach Jim. Paki-unmute mo po. Coach Jim.
Mabilis. Yes. Hello po.
Hello po. Yes po.
Hi.
Hi, Doc. Hi, Doc James.
Hello po. Happy New Year.
Happy New Year. Actually, mabilis ang medyo natamaan ako actually vaccinated na ako. Pero ang lang yung ubo at saka sipon, wala akong lagnat. Ay baka ito yung bagong ngayon, variant. Tapos nahawaan yung anak ko. Linagnat. Pero awa ng Panginoon na gumaling sa sa Alta Immune kasi every hour nagpatak talaga kami, talagang consistent. Tapos kami ng lemon. Saka talagang ginawa namin juice, talagang tiniis ko yung asim. Talagang at tapos nag-steam ako. So magandang effect sa akin kaya sinishare ko sa mga kababayan natin, mga partners natin na Alta Immune. Actually hindi naman siya pang-cure pero nakakatulong talaga. Kasi yung ubo ko parang malay, talagang grabe. So hindi tapos lumalabas ang sinabayan ko yung peppermint na essential oil kaya lumalabas yung sipon. Kaya until now medyo medyo So yun lang sister natin sa mga partners natin na Alta Immune. Sabayan nyo rin ng healthy na.
Yeah, okay. Thank you so much for that, Coach Jim. Oo. Kasi, totoo naman kasi known for all these properties itong mga active ingredients natin. Of course, ang inaano lang natin dito, of course, syempre kung iba yan tatanungin, sigurado ka ba na COVID yan or what? No? Pero of course, it doesn't have to really be COVID. Sabi ko, kahit ano pong virus yan na nagkukos ng same or similar na manifestations just like other bacterial natin, pwede naman po. So, ang lang yan is, well, of course, sabi ko nga, hindi lahat talaga very, sa mga other interventions or yung mga natural remedies, no, kagaya niyang ng increasing the vitamin C dose ng ating lemon and all that. Even some, okay, hindi rin ganun dyan sa suob or yung steam inhalation. But then of course, alam natin talaga nakakatulong yan. So, but of course, kanya-kanya ng ng kanyang paniniwala. Although kasi sabi ko nga, meron talaga na nagkakaroon ng magandang epektibong resulta sa paggamit ng mga ganyang alternatibo. So, of course, yes, it could really be helping. And then of course, yes, kahit ano ba yan, virus na yan or bacteria, it could be also be eradicated. So at that early onset. But of course, kung sobrang overtly na, sobrang ubong-ubo-ubo na medyo talagang may problema din sa pag-expectorate, then of course, kailangan talagang konsultahin ng doktor para at least makatulong sa pagpapaibsa ng mga sabi ko nga, prevention is better than cure. But then even before you could actually be acquiring, but since of course si Coach Jim nga nagsabi talaga na acquire niya despite him using the Alta Immune. So just like the vaccines din po, hindi po tayo absolutely guaranteed by the vaccine. So but then of course we are resorting to it, magpapabakuna po tayo para po hindi mag-severe ang mga progression ng ating mga na-acquire na the virus. No? Hindi tayo maging pang-ICU, yung mga ganun ba. So ganyan din lang po yung sa atin sa Alta Immune. It's not an absolute na parang so magical that everyone would say na, wow ito na lang ba ang iinumin namin. May mga ganyan no? Well yes, sabihin ko sa kanya, prevention is better than cure. Then of course, yun nga, meron din po mga tao, pag during the height of the na binibentahan mo, pilosopo. Pero pag the height na medyo may sakit na sila umubo, pwede ba yan, ganyan-ganyan? Of course, yes. Okay, I would recommend, but then of course, it's not that, I'm telling them that's just the empiric. And then of course, even before it could be progressing to moderate or even severe, then you can be preventive onto that. So, nakakatulong naman po. So, that's good. At least marami na tayo naniniwala. Kasi ako talagang, I have witnessed that, my family members really went through na, of course, at the height na medyo hindi pa kami vaccinated. Vaccinated na kami, isa na lang, no, siya pa yung nag-cause ng infection sa amin. So nahawa kami even we're vaccinated. So at that height, medyo talagang naniwala ako that of course it really works, especially at the early onset pa lang. Kahit or early onset, no. So medyo it has eradicated all, no, na kasi talagang positive yung mom ko and everyone. So I actually made use of this. And some other patients that I have actually given or introduced this, that they really believe that it has worked on them. Mm-mm. So, yun po. Okay, thank you, Coach Jim.
Yan.
Oo.
Thank you. Thank you, Coach Jim. Oo. In addition lang dun, Doc, parang, syempre, yung kay Coach Jim kasi na case, kumbaga, alam niya na virus or viral talaga yon na yung Alta Immune is really for viruses, di ba? Yeah. Kaya sa kanya, kumbaga, nag-overdose siya noon. Yes, oo. So, unlike kasi yung iba, ang tanong kasi nila Doc kung this Alta Immune will work doon sa mga, yung mga na-stroke, yung, di ba? So, it's a different case po kasi.
Yeah,
no? So,
iba yun.
Yung dito, it's because of the variant ng Omicron. So, it is a virus, kaya yung Alta Immune, diretso rin, yun yung makakatulong, di ba? So, yun lang po yung gusto nating linawin din sa kanila para hindi nagkakaroon ng, ng confusion. Okay, so, thank you, Coach Jim, for that. So, ang isa po dito, meron lang Doc na sabi niya, please tell Doc that I have a private message sent. Naku, may confidentiality, no? And please do not mention my name due to the confidentiality. Okay, sige po.
No. Ma'am, hindi ko ta narinig. Anong internet mo?
So internet ko ba? Meron daw po may private message sa'yo. So ayaw lang niyang ipa-mention yung name niya because it is confidential. Yon. So, okay. Meron lang, okay, Doc, meron pahabol lang dito. Sige, last one. Pwede po ba uminom ng Alta Immune yung mga on blood thinner meds?
On blood thinners, hindi.
On blood
oo. Kasi normally, okay. Di ko, wait. Kasi let me just rephrase that. No? Of course, yung blood thinners, yung mga statins or yung mga ganyan, mga warfarin, Coumadin, marami yan, iba-ibang klase yan eh.
Opo,
anong klase? Oo. So, hindi ko alam kung especially for those who are going for some surgical procedures, definitely ini-stop yan at least 2 weeks. So why are they going for some or even thinners, binabawal yan sa mga surgery. So pero of course I have to know of course the hindi siya talaga overtly being given to those who are on thinners. So wala ako kasi pang kaso talaga that I've actually recommended it for those who are actually on active thinners. Oo.
Okay. Yes, thank you for that, Doc. Although natatandaan ko, Doc, sabi ni Doktora Sheila Tiru, kumbaga itong Alta Immune kasi natin, in-extract niya yung lahat ng kumbaga parang component ng ingredient that will indicate dun sa mga klase na ganyang yung merong blood thinning, etc. No, but still the best thing to do is consult your doctor na rin.
Consult your physician if you know they will
Yes.
allow you. Kasi sabi ko, iba-ibang kaso kasi. Of
Iba-ibang
course,
kaso.
I cannot really be just, thank you. Giving it, sorry medyo yung aking patulong. Medyo case to case basis, pero of course we don't give it.
Yes.
So ask your physician about that.
Yes. Okay, so that ends our discussion for this afternoon. Thank you very much, Dr. James Buado, for your time and for accommodating all those questions. And thank you so much po sa lahat ng nag-attend for this afternoon session. So we hope that you learned a lot from the discussion that Dr. James with you. So take Alta Immune. You have to be very careful at mag-ingat at hindi lang po doble, triple, kundi sobrang ingat po because hindi po biro ang magkasakit ngayon. Okay, so that's all for this afternoon. Rise and shine!
We provide.
Yes.
Thank you. Okay,
Thank
be safe
you.
everyone. All right.